Here are 10 Puerto Rico Medical Board style clinical vignettes focused on lung anatomy, each with 4 answer choices and detailed explanations. Lung anatomy clinical vignettes. 1. Lung lobes and bronchial anatomy. A 35-year-old male presents to the emergency department after aspirating a peanut while laughing during a meal. Which airway structure is the most likely site for obstruction? A. Left main bronchus. B. Right main bronchus. C. Left upper lobe bronchus. D. Right upper lobe bronchus. Right main bronchus. Explanation. The right main bronchus is wider, more vertical, and shorter than the left, making it the most common site for aspirated foreign bodies. Lung pleura and pleural effusion. A 60-year-old woman with lung cancer develops a pleural effusion. Thoracentesis is performed below the 10th rib at the midaxillary line. What is the greatest risk of this procedure? A. Pneumothorax. B. Liver laceration. C. Diaphragmatic hernia. D. Esophageal injury. Answer B. Liver laceration. Explanation. The pleural space extends down to the 8th rib anteriorly, the 10th rib laterally, and the 12th rib posteriorly. Inserting a needle below the 9th or 10th rib increases the risk of liver injury. Ashashasa 3. Lung blood supply. A 45-year-old patient undergoes a left pneumonectomy for lung cancer. Which artery is primarily responsible for supplying oxygenated blood to the remaining lung tissue? A. Pulmonary artery. B. Pulmonary vein. C. Bronchial artery. D. Inferior phrenic artery. C. Bronchial artery. Explanation. The bronchial arteries provide oxygenated blood to lung parenchyma, while pulmonary arteries carry deoxygenated blood for gas exchange. 4. Pulmonary innervation. A 50-year-old male smoker presents with hoarseness. Imaging shows a lung mass in the left hilum. Which nerve is likely compressed? A. Phrenic nerve. B. Recurrent laryngeal nerve. C. Vagus nerve. D. Answer B. Recurrent laryngeal nerve. Explanation. The left recurrent laryngeal nerve loops around the aortic arch and can be compressed by a left lung mass, causing hoarseness. 5. Lung lymphatic drainage. A 55-year-old woman has a tumor in the left lung that has metastasized to the right paratracheal lymph nodes. This suggests abnormal drainage of which region? A. Right lower lobe. B. Right middle lobe. C. Left upper lobe. D. Left lower lobe. D. Left lower lobe. Explanation. The left lower lobe drains to both the left and right lymph nodes, so cancer can metastasize to the right paratracheal nodes. 6. Diaphragmatic innervation. A 45-year-old patient with phrenic nerve damage is experiencing hiccups and difficulty breathing. Which spinal nerve roots contribute to the phrenic nerve? A. C1-C3. B. C3-C5. C. T1-T3. D. L1-L3. Answer B. C3-C5. Explanation. The phrenic nerve, C3-C4-C5, controls diaphragmatic movement, making it essential for breathing. 7. Conducting zone versus respiratory zone. A 22-year-old student inhales a small dust particle which reaches the respiratory bronchioles. Which of the following best describes this region? A. Contains goblet cells and cilia. B. Lacks cartilage but contains smooth muscle. C. Has no alveoli or gas exchange. D. Contains stratified squamous epithelium. Answer B. Lacks cartilage but contains smooth muscle. Explanation. The conducting zone, trachea to terminal bronchioles, has cartilage and goblet cells, while the respiratory bronchioles, beginning of the respiratory zone, lack cartilage but still contain smooth muscle. 8. Pulmonary lobule anatomy. A pathology specimen of a patient with emphysema shows enlarged air spaces in terminal bronchioles. What is the basic functional unit of the lung where gas exchange occurs? A. Alveolar sac. B. Pulmonary lobule. C. Respiratory bronchiole. D. Acinus. Explanation. The acinus consists of the respiratory bronchioles, alveolar ducts, and alveoli where gas exchange occurs. 9. Pulmonary vascular resistance. A 65-year-old man with pulmonary hypertension is found to have increased vascular resistance in a specific region of the lung. In an upright person, which lung zone has the highest vascular resistance? A. Zone 1 apex, B. Zone 2 midlung, C. Zone 3 base, equal throughout the lung. Answer A. Explanation. The apex of the lung has the highest vascular resistance due to lower perfusion, low hydrostatic pressure. 10. Relationship between lung and chest wall. A patient with a traumatic chest injury has a collapsed lung but an expanded chest wall on one side. What is responsible for the outward recoil of the chest wall? A. Surface tension. B. Alveolar pressure. C. Elastic properties of the chest wall. D. Transpulmonary pressure. Answer C. Elastic properties of the chest wall. Explanation. The chest wall has a natural tendency to expand, while the lung has a natural tendency to collapse, creating negative intrapleural pressure. Final thoughts. These high